Good day. I am Jasmine Lawrence A. Resurreccion, a student nurse from BSN Level 1, Section 1. So today I will be demonstrating the range of motion exercises. But before that, let us define first what is a range of motion exercise and what are the purpose of this. So range of motion exercises aim to improve a specific joint movement, and it has three main purposes. First is for the maintenance of a current joint movement. Second, for the restoration of joint movements that have been lost due to diseases, injury, or lack of use. And lastly is for the strengthening of muscles. So in performing the range of motion exercises, we also need to ensure that all of our equipments are complete and consider all the contraindications. First, for the equipment, we need to have BP apparatus, stethoscope, thermometer, and pen and paper for the recording of data. Now, we need to consider the contraindications, so we shouldn't perform the range of motion exercises if our client's joints are inflamed or it has an injury within the vicinity of the joint. So before I proceed in demonstrating the whole process with my client, I will demonstrate all the range of motion exercises first. So I will be conducting it in cephalocodal, so from head to toe. So first is the neck. Flexion. Position your head as if looking down at your toes. Extension. Position your head as if looking straight forward. Hyperextension. Position your head as if looking straight at the ceiling. Lateral rotation. Position your head at the middle and move your head and side to side. So for these shoulders, flexion. Raise your arms up above your head. Extension. Raise your arms downwards at the side of your body. Vertical abduction. Raise your arms out and up. Vertical adduction. Bring your arms to the side of your body again. Well, for the internal rotation, rotate your arms across the body. External rotation, rotate your arms outward and keeping your elbow in 90-degree angle. So, flexion, extension, vertical abduction, vertical adduction, internal rotation, external rotation. Now, for the elbow, flexion, cup the elbow, and bend the arm. So, cup the elbow and bend the arm. While for the extension, straighten the arm. Okay? Flexion, extension. Next, for the wrist. Flexion, again, same, cup the elbow, and grasp the palm of the client. And for the flexion, bend the wrist forward. While for the extension, straighten the wrist. Okay? While next, radial deviation. So, bend the wrist towards the thumb. Like that. Ulnar deviation, bend the wrist towards the pinky. And then, circumduction, move the wrist in circular movement. Okay? So, flexion, extension, radial deviation, ulnar deviation, circumduction. Okay? Next, for the fingers and thumb. Flexion, so bend the fingers and thumb into the palm, like this. Extension, straighten the fingers back to its original position. And then abduction, spread the fingers. Spread the fingers. Adduction, move the fingers to a closed position. Okay? Next, circumduction for the thumb. So, rotate your thumb in circular movement. A position, touch the thumb to each fingers. Like that. Okay, again, flexion, extension, abduction, adduction, circumduction, and opposition. Okay. And now for the hip and knee flexion. For example, this is the leg of the client. So lift the leg, bending the knee towards the client's head. While extension, return the leg to the bed in a straight position. Abduction, move the leg outward the edge of the bed. Adduction, return the leg to the midline. Next, internal rotation. So roll the entire leg inwards. External rotation, roll the leg outward. So again, for the hip and knee, flexion, extension, abduction, adduction, internal rotation, external rotation. Now for the ankle, you have dorsiflexion, cup the heel and bend the ankle towards the upper body. Plantar flexion, cup the heel and push the ankle downward to point toes. While circumduction, rotate the foot, moving it from one direction to another. So again, dorsiflexion, plantar flexion, circumduction. Now for the toes. For the toes, bend the toes downward for flexion. Extension, bend the toes up. Abduction, spread the toes. Adduction, return the toes to a closed position. Again, flexion, extension, abduction, and adduction. So now we will proceed in performing the process with a client. So first is assessment. You have to assess the client's joint mobility and activity status. Second, assess the client's general health status. And third, assess the client's ability to participate. So this will ensure that the client is suitable in performing the range of motion exercises. And in the assessment, we can also consult the physician about the current medical diagnosis of the client. And this will help us to plan an effective intervention. So in planning, first plan time of exercise. So the range of motion exercises can be performed either once or twice a day. And then plan type of exercise can either be passive, active, or active assisted depending on the health status of the patient. That's why in the assessment, we need to assess the patient first to have a better planning. Okay, so now implementation. First, we have to gather all of the equipments. So the equipments are needed for the vital signs checking. Second, wash your hands. So hand washing can help us prevent cross-contamination between the nurse and the client. Next, identify the client and then explain the procedure to the client. So in identifying the client, this will ensure that we are performing the right procedure to the right client, and in explaining the procedure to the client, this will help alleviate the client's fear or anxiety, and then the nurse can also encourage the client to participate. Okay, so now, good afternoon, ma'am. I am Jasmine Lawrence, your student nurse for today. I would just like to confirm your information, ma'am. What is your name again? Your birthday, ma'am?
June 27, 2003.
Okay, Ma'am Cherry Lou. So I will be performing the range of motion exercises from head to toe. So this will also help you in your healing process, ma'am. May I have your consent, please?
Yes, you may.
Okay. So now that we have verified our client, we can now provide for privacy. So we will draw the partition and ensure that the environment is silent and doesn't have any distraction. So this will also aid in the concentration for the nurse and the client. So next, after checking the environment and drawing the partition for privacy, I will now check the bed and the client. So first, we need to lower the bed and position the client in a supine position. So this will ensure that the client is in a comfortable and accurate position, and also the joints and body parts are all accessible for the nurse while performing the exercises. Okay? So now that the client is in a comfortable position and in a supine position, I will now check her vital signs initially and also check it in between the procedures. So this is to ensure that the condition of the client is okay and it's not affected in between the procedures. Okay, so after that, I will now perform the range of motion exercises. So cephalopodal from head to toes. Okay, so let's start at the right side of the client. Okay, let's start. Flexion, extension, hyperextension, lateral rotation. Flexion, extension, hyperextension, lateral rotation. Okay, next, shoulders. Flexion, extension, flexion, extension, vertical abduction, vertical adduction, abduction, adduction, abduction, adduction. Next, internal rotation, external rotation. Next, for the elbows, flexion, extension. And now, for the wrist, flexion, extension, flexion, extension, radial deviation toward the thumb, ulnar deviation toward the pinky. Circumduction, circular motion. Now for the fingers and thumb, flexion, extension, okay, abduction, adduction, close, abduction, adduction, circumduction, now opposition, touch the thumb to each finger, okay, okay, for the arms, let's now proceed to the hip and the hip. Okay, flexion, extension, flexion, extension, abduction, adduction, abduction, adduction, internal rotation towards the midline, external rotation outward. Okay, after the hip and knee, now let's proceed to the ankle. Dorsiflexion toward the upper body. Plantar flexion, point the ankle, point the toes. Okay? Dorsiflexion, up. Plantar flexion, point. Circumduction. Okay. For the toes, flexion, downward, extension, straight. Abduction, adduction. Adduction, adduction. Okay? So after in the right side of the client, let's proceed to the left side of the client. Since we have already performed the neck, let's proceed directly to the shoulder. Okay? Flexion, extension. Flexion, extension. For the elbow, after the flexion extension, vertical abduction. Vertical adduction. Then, internal rotation. Cross, sternal. Okay? And then, this is the part where the elbow will flex. So, flexion, extension. After the elbow, wrist. Flexion, extension. Flexion, extension. Radial deviation, polar deviation. Radial deviation, polar deviation. Circumduction. Okay? Then, for the fingers and thumb. Flexion, extension. Flexion, extension. Okay? Next, abduction, adduction. Abduction, adduction. Abduction, adduction. Circumduction of the thumb. Then, opposition. Okay. After, let's proceed to the hip and knee. Flexion, extension. Flexion, extension. Abduction, adduction. Abduction, adduction. Internal rotation, external rotation. Internal rotation, external rotation. Okay, so for the ankle, dorsal flexion, upward. Plantar flexion, point. Dorsal flexion, plantar flexion. Dorsal, plantar. Next, circumduction. Rotate. Okay? Rotate. Now for the toes, flexion, extension. Flexion, extension. Abduction, adduction. Abduction, adduction. So, after performing the range of motion exercises, we need to wash our hands and put the client in a comfortable position. Okay, so for the evaluation, need to evaluate if the client has fatigue, and then also evaluate if the client felt any joint discomfort while doing the range of motion exercises, as well as any joint mobility occurred while doing the exercises or after the exercises. And now for the documentation, need to document the type of exercise we performed with the client, and then document the response of the client. So that's all for the range of motion exercises.